Uh, Good evening and welcome to today's lecture on assessing acute malnutrition. Malnutrition can be said to be the inadequacy of nutrients. It can be moderately inadequate, it can be severely inadequate, it can be MAM, and it can be SAM. Now, let us look at how we assess acute malnutrition. This is our presentation outline, the contact point for assessment. We have to check for edema, we have to do the anthropometry, we have to do our clinical assessment, we have to interpret different indices, and we classified acute malnutrition. We have to differentiate with acute malnutrition with medical complication from acute malnutrition without medical complication. Our learning objective is at the end of the lecture, we should be able to list different contact points for assessment of acute malnutrition. We should be able to demonstrate skills for accurate taking of anthropometry. We should be able to recognize the clinical signs of acute malnutrition. And we should be able to interpret different indices and classify acute malnutrition. Assessment of acute malnutrition. What is assessment of acute malnutrition, and what are the different methods used to assess acute malnutrition? Uh, Assessment of acute malnutrition refers to a comprehensive evaluation to determine nutritional status of an individual. Of course, it is very important to know the nutritional status of an individual. By so doing, you will be able to classify if that individual is acutely malnourished or not malnourished. Acute malnutrition can be assessed through anthropometry using your MWAC, that is mid upper arm circumference. You have to also assess it using the weight or the height stroke length measurement. Uh, Acute malnutrition can also be assessed using clinical assessment, taking history of the patient and physical assessment. Or rather, you can do the biochemical assessment through laboratory tests. Why should we assess for acute malnutrition? A child with acute malnutrition is very vulnerable and at high risk of death because of deficiency and deterioration in the immunity of such a child. And to prevent such, we therefore need to assess acute malnutrition. What are the contact points for screening for acute malnutrition? This can be done in the community, at health facility, uh, integrated outreaches, schools, kindergarten, community celebration, etc. We can also assess them through OPD, ANC, that is antenatal care or postnatal care. Then what is anthropometric measurement? Anthropometric measurement is a technique used to measure body dimension to assess nutritional status of an individual. The measurement includes MOAC, that is mid-upper arm circumference measurement, taking weight, and assessing the patient through height or length taking. Steps needed in taking anthropometry to determine the biodata, the name, the sex, the age, next of kin, and the address of the patient or individual need to be assessed. We have to check for bilateral edema, and at the same time, we have to do the age checking. We can do this either through the use of height stick or through growth mile, either teething. Now let us look at what bilateral pitting edema is all about. This refers to swelling of both feet resulting from excess fluid in the tissue. That is the meaning of edema. It leaves a pit when a thumb pressure is applied on top of both feet for 3 seconds. Usually start in the feet and ankle. In severe cases, it progresses to the upper limb and face. Let us check for bilateral edema. You press your thumb and you check if there is a pitting. The moment there is pitting, then that child can be said to have an edema. As it has been shown pictorially, you can see the pitting in both legs. That shows that this patient is malnourished and he has severe acute malnutrition. So, and look at the bilateral pitting on its own can also be graded. It can be plus one, it can be plus plus, it can be plus plus plus. That is triple plus. That is primary, secondary, and tertiary. The primary bilateral pitting is below the ankle. The secondary is below the knees, including the lower arm. And the tertiary means generalized all over the body. This is pictorially represented as shown. And the moment this is identified, you know that the child in question has a severe acute malnutrition, which is SAM. The next step in assessment of malnutrition is measurement of mid-upper arm circumference, which is referred to as MOAC. It is used to assess wasting. It is a better indicator of mortality risk, and it is used for children older than 6 months of age, pregnant and lactating women as PW, and older person. We can use MAC to assess if they are malnourished or not. Let us see how we measure MAC in baby. We ask the mother to remove extra clothing that may cover the child's left arm and flex the child's elbow at 90 degrees. We locate the tip of the shoulder, acromion, and elbow, olecranon on the flex arm, determine and mark the midpoint between the tip of the shoulder and the elbow. This is shown in our next diagram. It is shown so. The tip you measure as shown and identify the midpoint of the arm. And now we use your tape to measure correctly. The tension has to be precise. You don't allow the tape to be loose. Accurate measurement can be achieved with practice, but then as you measure, it shouldn't be too tight and it shouldn't be too loose. Just the correct measurement is needed, and the indicator is there for you to measure and assess if the child is severely malnourished or moderately malnourished. For children 6 to 59 months, nutrition status is as follows. SAM, that is severe acute malnutrition. If MOAC is less than 11.5 cm, it is red color. If MOAC is greater than 11.5 and less than 12.5, it is yellow color. It is said to be moderately malnourished and not SAM. And for a normal child, the MOAC is greater than 12 or equal to 12.5 cm, which is the green color code. For pregnant lactating women, if they have acute malnourishment, the MOAC is less than 23.0, and if it is greater, it shows that the person or the woman in question is normal. For that category, it can be seen in the attached manual. At the same time, we can measure scales. We can measure weight of the child using different scales: the unit scale, the beam balance, the double beam balance scale, or the spring hanging scale. This is shown. A flat surface is needed in taking a measurement of weight, so as to reduce error. This is the pictorial representation of taking weight of the baby. Use the scale. Firstly, the mother or the caregiver has to take her scale. And secondly, she places the baby by the left side. And thirdly, the scale is taken and zeroed. When you give her the baby, the scale will now read the weight of the baby, excluding that of the mother, which has been zeroed. Then the Salter scale, that's the hanging scale, is shown pictorially. You can see the indicator as it goes. Uh, and For increased accuracy and precision, two people are needed, of course. For height measurement, look at the way for accuracy, two people are required. The knees are bent and are positioned properly for accurate measurement. This is seen. It has to be accurately, the child has to be accurately positioned. And for the length, the child has to be lied properly, the head tilted in such a way that it aligns with the board, and the measurement of the length is taken. This is just mainly for child that cannot really stand. This is shown pictorially. This is shown, and let us look at the anthropometric indices: the sex, the age, the height, and the length, and the weight. And to determine if a child H over H is red over yellow is a chronic malnutrition. In the second one, it is underweight. Here it is wasted, and W, that is weight over height squared, is BMI. Z-score can also be used to assess undernutrition. This is the Z-score. It is from 0 to 3 and minus 0 to minus 3. For children under the age of 5, if WFH stroke L is less than screen nutrition status is severe acute malnutrition. If it is greater or equal to minus 3 and less than minus 2Z, the nutrition status is MAM, that is moderately accurate malnourished. If WFH stroke LZ score is greater than or minus 2Z score, nutrition status is normal. Now let us look at if we want to calculate the nutrition using the body mass index, that BMI, it is calculated as using this formula: weight in kilogram over height in square, as stated below. Clinical assessment, it includes taking history and physical examination. Taking history involves medical, dietary, and socioeconomic situation of the patient. Physical examination, also more detailed examination of the patient from head to toe need to be taken, and sign of visible wasting or bilateral edema can also be identified. This is a wasting, visible sign of a severe wasting. You can see the muscle wasting agent at the limbs, looseness of skin, the presence of skin fold, and baggy pants. It is visible here. The child in question is highly malnourished, and this type of situation is said to be marasmus. It's said to be marasmus. Physical examination is as follows. In this case, the child is said to have a kwashiorkor. It's also a case of severe acute malnutrition, this time with edema. That is accumulation of fluid. Now let us look at the algorithm for classification of acute malnutrition. Acute malnutrition can be classified. It might have a medical complication. It might not have medical complication. It can also be severe acute malnutrition with medical complication, or it can be moderate acute malnutrition. It can either be SAM or MAM. The severe go to inpatient care, while the MAM with medical complication will go to inpatient treatment, while the severe acute malnutrition with medical complication will go to inpatient care unit. At the same time, we have acute malnutrition without medical complication. The one without medical complication will go to OTP, outpatient therapeutic program. Now, in summary, we have looked at contact point for assessment of acute malnutrition. We have also looked at anthropometry measurements, clinical assessment, and classification of acute malnutrition into MAM and SAM. Children with acute malnutrition will be referred to a clinician or other skilled health worker for a detailed clinical assessment. Thank you.